Next, we're pleased to have Michelle and Autumn join us from NuCara Medical to tell us about their programs and services. Like other presenters, if you have any questions, type them in the chat box and we'll get them answered for you. So go ahead, Michelle and Autumn.
Thank you guys so much for having us and inviting us into your guys' group here today. It's been a pure treat to listen to all of you. I'm going to try to share my screen here, so I'm hoping that I'm successful in doing that.
Beautiful.
Can you guys see my screen here? I'll try to blow it up a little bit so you don't have to see what's coming next. So again, I'm Autumn Kline, and then I have Michelle Willenborg here with me. I've worked here for 7 years. Michelle's been here for about 5 years. Here's our direct contact information. So we're gonna kind of tag team this a little bit, kind of go back and forth. We have NuCara Home Medical is based here out of Iowa, and we have 30 different locations in 5 different states. We do have 12 home medical sites. That's who Michelle and I work for, is our home medical division here in Iowa. And then of the other locations, of those 30, are pharmacy locations. We do retail pharmacy as well too, as well as a number of other services. So we really offer kind of a continuum of care around all aspects of home health services. I'm going to kind of touch on what is important to you guys in the spinal cord community today, since we have limited time. So I'm going to kind of touch on some of our rehab services that we do here at NuCara Home Medical. We do complex power chair systems. Sometimes we do a bad job of letting everybody know of all the resources that we do here in our community. We are still a locally owned and operated, even though we do have quite a few locations, kind of a mom and pop company. So you're going to see here we do anything from that cute little kiddo that's down there in the corner to adults, to geriatrics as well too. And we carry all different types of power chairs and seating systems as well. I get a lot of questions asked around that, about what manufacturers we carry. Permobile, Quantum, Invacare, the Rovi. We carry quite a few in our formulary. So, of course, standard power chair systems. So, your very basic joystick drive systems, not much seating, obviously, that can be adapted on this type of chair. We do rent these type of chairs on occasion as well too, depending on, kind of product ebbs and flows. Sometimes we have quite a few that we can rent out. Sometimes our inventory is all out, and we'll have to send you on to another resource. We try to be a good partner within the community amongst other people that do very similar services. So if we don't have it and don't carry it, we try to connect you with somebody in the community that does, to be a resource that way as well. Scooters, all different types of scooters, from things that are very portable to things. The newest one actually is this little white guy here. It's got a little 0 turn radius on it. Ultra lightweight chairs, or K5 chairs, again for both pediatrics and adult versions of those chairs. We do carry the Tylite, ProSpin, amongst a number of other types of ultra lightweight chairs as well too. Rehab styled shower chairs. And then this is, more importantly, our rehab service. These are the individuals that would add equipment, work with individual too that is having a need for that type of this is service here. We kind of have it spot up in the northwest corner currently. But Melissa Clue is our ATP, and she's the director of our rehab services. So you'll see her picture there. She supports all of our ATPs and all of our technicians here in the state of Iowa. We do have coordinators, so a lot of them are on the road a lot, attending evals. If somebody's chair is breaking down, they're going out and doing the repair. So we have somebody that's this internally way. If you're having an issue with your chair, it breaks down and you have a more immediate need and you need to get a hold of somebody, Sarah Estes, and I know a lot of this is real small, so I'm happy to send this to Angie or Jen or any of you guys after this, but she's kind of our internal person that takes phone calls and helps to manage actually all the paperwork. You know, if somebody needs a new chair, she works with the physicians a lot as well too. So she's kind of our coordinator. So I'm going to pass the baton real quick over to Michelle Willenborg, and she's going to talk to you about our respiratory services.
Hi, good afternoon. Thank you so much. And yes, so respiratory services, we will start with our non-invasive ventilator program that we have. We do use two different types, Astral and Trilogy, and we're supported by both of the manufacturers across the board. As you can see, ventilator usage for patients in wheelchairs that are requiring any ventilation usage during the day, we were able to accommodate that. So not only the chair portion of that, but the ventilator use as well. And then at night, you know, using that non-invasive ventilator at night, we have the support of our respiratory team. They work closely with the end user, patient, caregiver, as well as the provider, and just providing information and assessment, clinical data that's gathered in the home, working with discharge planners if it's something that's coming out of the hospital. So our respiratory team is part of that. We also provide airway clearance. This is actually our Afro vest that we have used, and again have quite a bit of support from the manufacturer. This particular vest can be found in 7 different sizes, and it has 9 different settings on it. It's like having 9 respiratory therapists beating on you for airway clearance. It's very mobile. It's not connected to a compressor, so you can put it on and you can be mobile with that. Really good for either anyone that's in school or that is actually in the working environment. Cough assist. As you can see, this is a mechanical device. This is going to stimulate coughing by gradually introducing some big breaths just to get that diaphragm and those lungs working so that you can administer some airway clearance that way. And then Autumn will take care of the medical supply piece of this.
So medical supplies, again, we do a plethora of things, but I'm only going to focus on a few things for you here today. You know, we do urological supplies, slide boards, hospital beds, both manual ones and powered ones, support surfaces too, like low air loss mattresses. I know I don't have that on that list. I accidentally left it off, I guess, as I was making this. Again, we do so many things, I forget sometimes everything that we do. Patient lift or Hoyer lifts, commodes, stool risers. Those are just some of the medical supplies that we do. I'm going to turn it back over to Michelle on our home modification services.
So we have our own team of home modification guys and girls. They are SEAC certified, that's certified environmental assessment consultants. So they will go in and assess the environment, and that is a free service that we provide. We can do grab bars, so any bathroom safety, you know, either remodels or just doing some grab bars to keep from falling in the shower. As you can see, we have a 0 entry for easy access into the shower. We can do that. We can provide vertical platform lifts, as well as ramps. So you can see here we have the aluminum ramp. We can also customize a wood ramp. So these services are, you know, anything from the home entrance and then within your home, in your bathroom, in your kitchen. And then, you know, we also do, as I mentioned, that free in-home consultation. Those are installed by our trained consultants. We have local support and service. And then on occasion, we will have a rental ramp and stair lift programs available, just depending on quantity, you know, whether or not we have the stock for those. But we can talk all day about home modification, and I know we're limited here. So what we've done is we've added in our brochures. Here you're going to see our general use, our general services brochures. It's going to walk you through respiratory home modification and mobility, touching on just a little bit of everything we do. We've added in our home modification as well. As you can see, home modification department, there's a phone number there. Rachel is our coordinator for that service that we provide. Her phone number and email are there in the middle. And
one
then
thing I want to touch on, can I jump in real quick, Michelle, on these department phone numbers? So you're going to see here the home modifications department has their own number. Rachel supports them, like Michelle was saying. And then we also have that rehab service component where Sarah Estes supports that team. So a lot of times when you call into any of our 12 locations, what you're going to get if you dial just our main location is our frontline customer service team. A lot of times then they will transfer you to these specialized teams that do more of our complex services. But what's nice is we do have published numbers for both Sarah Estes and our home modifications department where you can actually reach out to them directly and just bypass, you know, all of our customer service teams. So these numbers are like your true people that know the details, ins and outs, insurance coverage, you know, if we have any rentals in stock. Sometimes with our general customer service team, you know, they have to know the whole gamut of what we do here at NuCara Home Medical. So we always like to give out their direct numbers because sometimes we never want to get somebody tossed around a bunch of different places through our customer service team. So I'll turn it back to you, Michelle.
All right, thank you. No, and that's a really good point. And again, we're just showing you more of that home modification brochure. Here we have a list of all of our locations. You will see that 9 of them are what we formerly were known as Hammer Medical Supply. We have our legacy home medical supply there. Nevada, Cedar Falls, and Waterloo are new to us as the NuCara team, you know, pharmacy side of it, and the NuCara HME side joined forces with Hammer Medical. So we're really growing. Again, more pharmacy information. So continuum of care, like Autumn said, we have the pharmacy side, the HME side, the home modification side. So we really can get in there and get every one of your needs taken care of. Here, showing you more where our pharmacies are. On the map, you can see HME locations designated with a green, and then our pharmacy locations designated in blue. And then on the back side, you will find each location's address, phone number, and fax, and the city that they can be found in. And I think that, yep, that was the end. So thank you.
Anybody have any questions that we can answer in regards to medical equipment? If I can stop sharing.
All right, let me see. They are wondering if, Shelley, can a shower chair be tested out?
Absolutely. So we did provide in that first slide, Michelle and I's direct contact information. So if you guys ever want to, you know, sometimes depending on how specialized it is, sometimes we'll have to bring it in from our manufacturer. So sometimes that can take a little bit of time, you know, for us to gather the information and then reach out to them and then get in if it's a real specialized piece of equipment. But absolutely, we encourage that with any type of complex rehab piece of equipment, you know, to try that out, whether it even be a chair or you know, a Hoyer lift, any of those types of pieces of equipment. I always strongly, we could do it with your therapist there, you know, your aide there. Since we can't physically as suppliers, you know, touch people for liability reasons, of course, a lot of times we'll help, Michelle and I too will help to coordinate with that with somebody that you may be working with, you know, either in the home, you know, or your therapist. So don't hesitate to reach out to either one of us and we're happy to be a resource for you.
Travis continues on that and asks, has anyone had luck getting a shower chair covered by insurance? That's always a tricky one.
It is. It really is. And that's where we dive in on our side. Now, the rehab shower chairs that we actually showed, those are covered by insurance. If it is something that is just general or basic, we won't see Medicare pay for those, but some Medicaids might pay for those. It really just depends, and that's where we have to dig in a little deeper on what insurance coverage primary and then secondary is. But we'll bring in our team, you know, definitely working on those rehab shower chairs and be able to answer those questions before we would walk forward and let you know that you wouldn't have any surprises.
Another thing that I really encourage for you guys as well too is another service that we can provide for you is Michelle and I work hand in hand with the therapist or the doctor. The most important piece of the process is making sure all the T's are crossed and I's are dotted on documentation. So on those notes that are going to be sent in for prior authorization, let's say through insurance, it's so important that everything has been, you know, justified in that letter of medical necessity. And we have so many different like forms and different things that we're happy to that process.
And I think the last question was if you carry ceiling lifts.
We do not carry ceiling lifts anymore. We used to.
Thank you so much for your explanation of everything you carry. I think a lot of our members will take advantage of that. We'll be sharing your information with everybody, and just thank you so much for your time.
Thank you.
Thanks again for having us.
Thanks for having us.